Hello, I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore Iowa's stories of survival, hope, and inspiration. Throughout Iowa, many professionals await the annual Iowa Drug Control Strategy and Drug Use Profile released by the Iowa Office of Drug Control Policy. It's a way to look back over the past year, see what we did well and what needs work, and what challenges may loom on the horizon. In short, the facts are clearly represented to get a good look at the big picture. It's a very good place to get a snapshot of drug use in Iowa, and that can help anyone dealing with substance use disorder. We've asked Dale Woolery, Director of the Office of Drug Control Policy, and Susie Scher to share some insight into what's happening in Iowa and why this report is so important. Dale, Susie, welcome to the show. Dale, give us a little heads up on who you are, what you do, and why this report is so important.
Thank you, Peter. I appreciate the invitation to be with you today. And yes, we believe it's an important report. We kind of look at it as a blueprint, but I guess not to get ahead of myself, I'm the director of the Governor's Office of Drug Control Policy in Iowa. And we're a small office that works on policy issues, program issues, and the coordination of all the above, because this is a complex set of issues, a lot of moving parts, and a lot of different responses, and constantly changing. But to the report itself, it's something that this office has issued by Iowa law. We're required to issue annually in November to kind of update everyone, Iowans, and then also our elected officials who serve in the legislature and the governor's office on the state of affairs. So what's trending? What are the challenges? What progress is being made? What's working, what's not working, what public dollars, tax dollars are being spent. And so it's a general accounting for where we've been, where we are, and then strategically where we need to go. So it sets out some very broad priorities so that those of us in state government anyway can all kind of hopefully be on the same page, working on multiple fronts, but with some common themes, and that's the nature of the report. It's actually written and edited in our office by Susie, who's with us, and so I'd turn to Susie for additional information because she has the inside scoop on what's really going into it.
Thanks, Dale, and thank you, Peter, for having us. My name is Susie Scher. I am the Policy and Public Affairs Manager here at the Office of Drug Control Policy. And as Dale mentioned, I am the editor of the annual Drug Control Strategy and Drug Use Profile report. The report this year kind of breaks down prevention, treatment, and enforcement efforts in the state. We talk a lot about innovative ideas and approaches to dealing with substance use disorders. We talk about lots of programs that lots of different state agencies are currently using. And then we go into a really detailed data section, and we talk about trends over the past few years. We have a ton of data in there that's available. We break it down by substance. So we talk about alcohol and tobacco and illicit drugs as well.
Now, let me ask you a question, because one of the things that fascinates me about the report, having read through it, is I think to myself how many different questions people have raised to me throughout with the show and work throughout the state that are actually answered by information report. I mean, this is not just for top-level policymakers and legislators that a mom or a dad sort of interesting as to what's out there, because not everybody has experience with this on a day-to-day basis. Yet I felt the report was sort of accessible to me. In that context, what is like the goal of the report actually? Does it really serve that purpose as well? Do you see that working with the general public?
I do. I'll take a stab at that, Peter. I think it is for all consumers, and so it's written in a way to be relevant, I think, to all Iowans, and really to try and help answer a lot of questions. But I think one of the more important questions in my book is, what can any Iowan do to help prevent or address substance use or substance use disorder in the state of Iowa. And while we can't all do it all, there are some things a lot of us, if not all of us, can do at the individual level. And then there are some things that requires professional input, and it's group efforts. So you have a range, and I think you can see that in there based on the needs and some of the strategies, down to people like myself as a grandfather and father speaking with our kids and now grandkids about the facts, and pointing out that there are risky choices and there may be consequences, and here's what you can do to avoid those.
You know, I'd like to start going down the list and taking a look at what you do have to say about the problems in Iowa and the successes we've had. Let's do that after the break. When we come back, we'll continue the conversation with Dale and Susie. We'll see you all after the break. You don't want to miss this.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today, more than ever, you need fast, reliable internet. At Mediacom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power and 99.99% network reliability. So even though these are uncertain times, we're prepared, and you can be certain we'll keep your world connected. Every second, 127 new devices connect to the internet. You can feel it happening, our digital world expanding with every breath. We're entering a whole new era of connectivity, and Mediacom will be ready to power it with one of the nation's first 10G platforms. We'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Welcome back to Surviving Bad. We're talking with Dale Woolery and Susie Scher about drugs and substance use in Iowa. Susie, we're talking about this great report, which I can attest to is very readable for the general public. But can you share some sort of highlights and lowlights from the report? What are we learning about drug trends in Iowa?
Sure. Well, overall, the state of Iowa ranks fairly low in the nation in illicit drug use. I think we're 41st in the nation. But on the flip side of that, we have above average rates of tobacco, alcohol, and meth use. Alcohol-related deaths have actually been climbing, as are opioid and psychostimulant, mostly meth-related deaths in the state. Traditional tobacco use is declining, but vaping, we know, really kind of took over, and we've seen a lot more vaping. As far as marijuana goes, in the state of Iowa, we see a lot more concentrates now, which actually have a very high level of THC in them. The average in the nation was around 60% THC in some of those concentrates, which is much, much higher than the plant products. Meth labs, we know, are nearly non-existent in the state of Iowa now, which is great, but meth is being imported into the state, and the appetite for meth is still there. Meth actually took over as the number one treatment for those admitted to treatment last year. Meth actually took over the number one spot. So that overtook marijuana for the first time. So meth is definitely still our biggest illicit drug problem in the state.
Dale, a question for you. We talk about meth, and it's a big problem, the illicit drug problem. But then there's, I guess, what I'm going to refer to as the non-illicit drugs, like alcohol and nicotine-based products. How are we? Susie mentioned we're sort of trending upward on nicotine or vaping-based products, upward on meth. Where's the alcohol situation? Because that seems to be the elephant in the room. There's a lot of alcohol use by youth in Iowa, especially.
Yeah, you're absolutely right, Peter. If you look at alcohol abuse or excessive drinking, however you want to define it, it dwarfs a lot of the other substances as far as its prevalence and misuse and all that could go wrong with that, whether it's traffic crashes, injuries on the job, violence in the home. And so we have seen an increase in alcohol consumption during the course of this year. And so we think it may be somewhat related to the pandemic and some of the isolation and just the change in the air. I mean that more figuratively, but so we're seeing more excessive drinking. We're not seeing, it's too soon, I guess, to make a lot of conclusions or draw a lot of conclusions about what the pandemic's effect has been. But nationally, the consumption of alcohol is up. And we're seeing an increase in alcohol-related deaths in Iowa, and they're on pace to exceed 700 in this calendar year, 2020. That'd be a big increase from last year. And while we're also seeing a rise in opioid overdose deaths and stimulant overdose deaths, those are all three concerning. But alcohol, again, by numbers, would dwarf the other two. Nicotine, same thing. It's the number one source of preventable deaths in Iowa. The use of tobacco products, as we used to talk about them, now more nicotine, because it's not all about smoking cigarettes, but you have the vaping coming into play. Good news there, possibly, although again, it's too soon to draw conclusions. We're getting some early reports nationally that some of the vaping use, especially by youth, may be turning downward, perhaps coinciding with the new legislation within the last year to raise the legal age for tobacco and nicotine products to 21 nationally and at the state level here in Iowa. So it's gotten a little more difficult for young Iowans in particular to access nicotine type products. And Susie's right, on the illicit side of the ledger, methamphetamine continues to be a kind of a rising challenge. And the one thing I would say that's almost uniform across all of the substances we're talking about here today, whether it's marijuana, opioids, methamphetamine, alcohol, nicotine, the potency has gotten much stronger over the last several years, but in the last few years in particular, they're all stronger, various forms. So there's a lot more to choose from. It's become a lot more accessible because of online sales and so forth. And again, what we don't appreciate enough, in my opinion, is the potency that's going higher and higher and higher. And while we don't have scientific research to tell us definitively that's not a good thing, it is concerning to me because intuitively, I think it presents more risk, and that's the kind of thing that we're trying to mitigate.
Well, I think you share that in common with the average parent raising a child or a young adult in Iowa today. We're going to take a small break and then come back and take a closer look at the kind of information from the report that can help you understand drug, alcohol, and nicotine use trends in Iowa. See you all after the break. You don't want to miss this.
While a lot is changing in our world, at Mediacom, our focus remains the same, making sure you have the fastest, most reliable connection possible. During this critical time, we know your needs are changing. You may be working or learning from home, relying on telemedicine, or finding new ways to keep everyone entertained. If you need more speed, call or go online, and Mediacom will double your speed immediately for as low as $10 more a month for 1 year.
I may never have met you. We don't go way back. Maybe we wouldn't even be friends if we did. But when you wear a mask, you have my respect. Because your mask doesn't protect you. It protects me. I wear my mask to protect you. Mask up, America.
Right now, millions of people and billions of devices are connected to the internet. Homes, businesses, hospitals, schools. The security and reliability of these connections are more important than ever. That's why at Mediacom, we've built a network to protect them. A network that sees threats, fixes problems before they occur, and keeps you going with 99.99% network reliability.
Welcome back to Surviving Bad. I'm your host, Peter Komendowski, and we're talking with Dale and Susie from the Iowa Office of Drug Control Policy about important facts. Yet there is more to the picture, and that's the importance of the work done by people that care about your health and well-being, especially in the face of threats from substance use. Dale, you've got a lot of information in that report. It's very readable, but you've got some ideas you want to share with us that are probably unexpected when people look at the show.
Well, we talk a lot about problems because that's what we're here to do, is to try and solve problems. But there's some progress to also, I think, report. And just a few things going down a list here. We had, again, it's early, but we think we're beginning to see a turnaround on the vaping. So we're hopeful that that will continue to go downward. We had fewer drug-related traffic fatalities in Iowa last year. Don't know exactly what might have been behind that, but it's always good to know, because there's more of a focus on drug driving in Iowa by law enforcement and educators, even though we did see a slight uptick in the alcohol-related traffic fatalities. One thing that I think is really important to share is the success of substance use disorder treatment. Consistently, the Iowa Department of Public Health has done research, and what they find is that completing treatment 6 months beyond that treatment regimen, Iowans are they're using fewer drugs, so the rate of relapse or reuse of drugs is down. The rate of reoffenses or being rearrested is down, and the rate of employment is up, and rather considerably. And so treatment does work. It won't necessarily work for everyone the first time, but in general, it does work. And so I think that's a success story that we need to hit home more and more, because there is a stigma with substance misuse, and we need people to be getting help instead of running away from it. We've got many more tools to address the opioid epidemic, which is in the shadows of the pandemic right now, but is still there, still with us. And again, as I said earlier, we're seeing an increase in opioid overdose deaths. But we have more naloxone that's available to reverse overdoses, opioid overdoses. We have more medication-assisted treatment. We have the Good Samaritan law, which is frankly underutilized to encourage people to call 911 instead of running from a scene of an overdose. So we have opportunities to change lives, and that's getting better all the time. We have more and more unused prescription medications being disposed of by Iowans properly, in a way so that they're removed from a house, so that you prevent the diversion and misuse of those drugs. But they also don't contaminate the environment. I think about 6 tons were disposed of in October this year. And a lot of communities are doing the hands-free, contact-free drive-through drop-offs. So even in a pandemic like we're in, that's something almost all of us can help with. If we have medications in the home, get rid of them safely and help prevent substance misuse. I guess some other positives, as I see them, we're having more focus on alternatives to incarceration for low-level offenders. So if you're drug addicted, or if you have a substance use disorder and you commit what might be a low-level offense and you're a low risk to the community, I think we're seeing more focus on alternatives to incarceration, to include programs that are focusing on diversion to treatment, away from the justice system to treatment. So we're getting help for individuals who need it more quickly, and not engaging in the justice system, which makes for more efficiencies and hopefully saves lives and saves dollars. And the other thing is that in this time of pandemic, we're seeing more distance-based telehealth services. So tele-treatment for substance use disorder, supervision for offenders in the community who otherwise might be in prison. And so I think that remote capability, while we don't know the degree of its effectiveness, it's something we're going to be looking at, because going forward post-pandemic, that could provide greater access to more services more efficiently for more Iowans. And I'm hoping that that's the case. It's something we're certainly going to be looking at.
Now, Susie, I have a question for you. You know, we know that we care a lot about rural populations, and a lot of times we're not talking about necessarily being underserved, but sometimes underinformed. This seems like it would be an excellent vehicle for rural populations, whether it's in the healthcare, a doctor's office, or even in a school, to gain a better understanding of the threats that may be out there. And it's not like Des Moines or Cedar Falls or Cedar Rapids, where the news can bombard you with this stuff. When you're living there, it's almost hard to see. Does this report have some basis for helping community-based prevention work?
You bet. I think it can help any prevention, treatment, enforcement people in the state. It's got some really good information on a lot of programs that are available that especially rural communities may not know about. We break down all of the prevention, treatment, and enforcement programs that we know about being done across the state. We have a little summary about all of each of those programs. If you access the report online, we have links to data sources where we get all our information. There's just a ton of information packed into the report.
Well, thank you very much. And when we come back from the break, I'd like to ask you both to share some final comments, maybe some advice with people, things you've learned on behalf of Iowans by going through all this data to put out this report. See us after the break. There'll be some great information. You don't want to miss this.
I don't know how we would have survived without Mediacom. We have 5 kids, my wife and I, and we have Mediacom for all of our internet and all of our cable services. So I'm stuck in my house, but at the same time, I'm connected to people all over the world, and it's been fantastic.
Thanks to Mediacom, I've had reliable internet to continue to work business as usual, that I can continue to provide for myself and my family.
Right now, we all feel like the world is in a standstill. The internet has played a huge role in allowing us to stay connected to our jobs and the kids' schooling online, and finding fun and creative ways to stay connected with the ones that we love. We couldn't do it without Mediacom.
Right now, millions of people and billions of devices are connected to the internet. Homes, businesses, hospitals, schools. The security and reliability of these connections are more important than ever. That's why at Mediacom, we've built a network to protect them. A network that sees threats, fixes problems before they occur, and keeps you going with 99.99% network reliability.
Today on Surviving Bad, we're taking a moment to talk about the facts when it comes to figuring out how to deal with substance use disorder addiction and the safety of your community. Let's listen to some advice from our guests, Dale and Susie. It's information that may make a difference in your life. Susie?
Thanks, Peter. So from my perspective in putting this report together and gathering all of the data and gathering up all the information on all of the available programs, prevention, treatment, and enforcement initiatives going on in the state of Iowa right now, especially in this year in light of the pandemic, I think it's really important that we remain flexible in our response to substance use disorder in the state. And I think we've seen that happen a lot this year, especially as Dale mentioned with telehealth and remote services being offered. I think there's a lot of great things going on in the state. Even though we certainly have substance use issues in the state that need addressed, we are doing a lot to address those, and remaining flexible in our responses, I think is really important.
Well, thank you. Dale?
I think we have a lot of good efforts going on to contribute to a good quality of life in Iowa, and we're thankful for that. But it begins in homes, it begins in churches, it begins in schools and communities. There's a lot that each of us can do in our own right. So for parents, grandparents, those who have families or friends, be engaged, have conversations, ask questions, monitor, and intervene where necessary. I think it's really important, especially in these days, given the pandemic stressors, that we are attentive and that we engage. And I think it's important to stay engaged, because the research indicates if we are engaged, especially with young Iowans, they are less likely to engage in risky behavior like drug use. That's not a guarantee, but if we apply ourselves, we can really make a difference. And I think if we look at this report, what it tells us is that Iowans are truly making a positive difference. We just hope we get that to continue and get better at it as we go forward.
That's fantastic advice. You provide a fantastic tool, and it does oftentimes come down to getting the resources in the right hands and the right people. I thank you all for the work you've done and for sharing some of the information that you have today. And thank you all for joining us today. For more information, you can go to our website, healthyiowa.org. Keep an eye on Mediacom MC22 for our next episode of Surviving Bad, where we explore Iowa stories of survival, hope, and inspiration. On Mediacom MC22, your local programming leader.